Good afternoon, viewers. You're watching News 9 Facebook Live with me, Surat Suresh. Well, the number of cases are on the rise in India, especially with this milestone that India has reached now. We are third worldwide with respect to the COVID-19 tally, taking over Russia as well. Now we just have Brazil and the US just above us. But nonetheless, now we are in the fourth month of COVID-19. Probably now all of us know what COVID-19 is, what kind of symptoms you'll be seeing, even though new symptoms are being added every other day with new studies being done with respect to what kind of effects does COVID-19 actually have on the human body. But even after all of that, there were several studies regarding whether or not the transmission of COVID-19, whether or not it can spread through air. Is it an airborne disease? This is a question which was asked time and again. Even in the month of April, there were several studies which were taken up by over 239 experts or scientists, and they were working on the same. They had even approached the World Health Organization, asking them to even rethink or revise their guidelines regarding whether or not COVID-19 is actually an airborne disease. Now, as of Sunday, what they have done is they have gone forward. They have written a letter, an open letter to the World Health Organization, asking the individual body to go forward and revise their guidelines, revise their advisories as well regarding COVID-19, because already we have seen the transmission. They have said that there are two types of transmission. It can be a droplet kind of transmission and it will be aerosol. So they have divided it into two, but the experts from 32 countries, they have come forward. They have said that there are possibilities that the virus can spread through air itself, the medium. So that is why they have asked the UN Health Agency to go forward and think about the same, hold a meeting as well. Even in the month of April, they had asked the World Health Organization or the UN Health Agency to go forward and hold a meeting and discuss regarding the same. But at that time, the World Health Organization had said that we'll just divide it into two categories, and apart from that, we'll not take it forward. But now, there are several concerns being raised as to how the healthcare workers will have to wear N95 masks, and there will have to be filters, and it is very important regarding the social distancing as well, because if at all social distancing is also maintained, whether 6 feet will be sufficient, or will they have to think about the kind of adverse conditions in which the virus can spread as well. So they will have to think about all of this now. World Health Organization on June 29th had said that airborne spread of the infectious disease is possible only after medical procedure that produce aerosols, droplets smaller than 5 microns. This is what World Health Organization had said. But now, again, probably they will have to rethink. So what is an airborne disease, and whether or not coronavirus can be considered as an airborne disease? To explain all of this, we are joined in by Dr. Pankaj Singhai, who is an infectious diseases expert as well as internal medicines consultant at Manipal Hospital. Many thanks for joining us, Doctor. Firstly, a lot of people have been asking regarding airborne diseases now that around 239 experts have said that it is an airborne disease. So what is an airborne disease? Can we consider COVID-19 or coronavirus as an airborne disease?
Yeah, thank you. Good afternoon, all of you. We are struggling to find out the solution about the pandemicity of the COVID-19. And day-to-day clinical practice, we are seeing number of patients are increasing, and this is really alarming for each and every person, including medical health workers. And first of all, we should know what is the airborne disease once we start discussing about the corona and whether it's an airborne disease or not. So an airborne infection is an infection that is contracted by inhalation of microorganisms or spores suspended in the air, or water droplets or dust particles. So as per se, like, it's not a direct airborne contamination, or maybe probably the microorganism or the virus or bacteria which suspended in the air or water, and once you sneeze or laugh or anything, just talking very loudly, then virus and bacteria can aerosolized through the coughing, sneezing, laughing, or through the close personal contact. So we already aware about the airborne infection in the past because we already struggled with the H1N1 infection last 15 years, and the controversy about whether this is airborne disease or not. So the coronavirus is an airborne disease, and several scientists have claimed that they requested the World Health Organization, as you said. So the virus lingers in the air indoors and infected those nearby. So basically, it's not a direct contamination of the virus through the air. So basically, it's holded by the droplets or maybe the some of the liquid or the dust particles which holding the air this virus and then transmit to the other person.
Absolutely.
So
Now, doctor, like you said, probably now that the experts have found that yes, there is a possibility that the virus will linger in the air and probably will stay for quite some time. Now, should the World Health Organization at this point reconsider and probably revise its guidelines? There are advisories which are given, standard operating procedures are given as well. So probably everything will change now if at all it is proven that it is an airborne disease. So should the World Health Organization at this point again reconsider and they have to go forward and revise their guidelines?
sure, while the coronavirus that causes the COVID-19 is not generally considered to be airborne, that's what the concept
Correct.
before starting the COVID infection. There may be some situation in which virus can act like an airborne disease. These include certain clinical settings in which people are receiving the medical treatment for the different clinical condition. So in usual, this situation of SARS-CoV-2 is spread through the respiratory droplets after the person coughs or sneezes, but these droplets are larger than what is to considered airborne. So that was the reason.
Correct.
So the most common the kind of condition which is transmitted through the air only, and then sometime if you're going to just dispose of the dust particle or the sneeze or some of the liquid from the nose or the mouth or saliva, so probably they're containing the virus or holding for the longer period of time. If you're going to touch it with a hand or any body parts and you're going to inhale it, so ultimately it goes to the nasal mucosa or mouth or maybe the ear, eyes also. So that's what the reason. If the WHO, I think they should consider as a primarily as an airborne disease rather than too much of about that.
Absolutely. Now, one important thing which you also mentioned about aerosol as well as large droplets. They have said that anything below 5 micron can be considered as aerosols, and then they can be considered as airborne. But if it's a large droplet, then it'll just be to some extent or to a certain distance as well. Now, should this be divided as such, or should they start considering that both of them can have their conditions or adverse conditions on the human body, and instead of dividing, they can consider clubbing both of them and see how they actually have an impact on the entire respiratory system?
Yeah, correct. Absolutely correct. You rightly mentioned about the droplet issue. So basically, the droplet size depends on if it is larger than 100 millimeters fall to the ground and dry out, and these becomes contaminated with the dust and which can later be inhaled or get into the body through the direct contact. And droplets smaller than 100 micromillimeter remains in the air and may travel over the short distance depending on the surrounding condition. So the very small droplet, as you rightly mentioned, the smaller than the 5 microns, dry up instead and therefore remain in the atmosphere for the longer period of time. And suppose somebody is going to cough in a particular probably object or anywhere in the table or any part of the the household thing. And these smaller droplets have the ability to better infiltrate the organism. So that organisms invade the nasal mucosa, lung, or any part of the exposed part of the body. So then that is what the reason everybody is come with the idea. You have to be, kind of wash your hands regularly for almost for 20 seconds with the soap or water or alcohol based hand rubs. So that's you can avoid the contact with the microorganism in the form of the droplets coming in, keeping for longer period of time in the like table or any household object. And cover your nose and mouth. What we have seen in the regularly in the around the community area,
Correct.
people are putting the mask over the mouth only rather than putting both the nose and mouth.
Correct.
With disposable tissues and flex elbows when you cough or sneeze. You have to cover it up. Avoid close contact at least for 1 meter or 3 feet with the people who are unwell. At least somebody is coming in contact with you who is not unwell, and stay home and self-isolate for others in the household if you feel unwell. And
Now,
don't
doctor,
touch your
you
eyes.
did mention about, a few of the criteria or few instructions that people will have to follow. Yes, masks are there, but probably people are not wearing it properly, and they will have to start doing so. Social distancing is one thing which there is a lot of controversy, or there is a lot of questions which are asked regarding social distancing. Now, earlier World Health Organization had said that 2 meter, social distancing, or that distance is not needed. 1 meter is sufficient. But if at all we consider that the COVID-19 or coronavirus is an airborne disease, how long can it travel? The distance that it can travel, one. Second, for how long will it be there in the air before it wears out from the air? And third, what is the distance that people will have to follow? And probably they can increase as well. For now, it is 6 feet, but should there be more distance that the World Health Organization should consider in its guidelines, or is it enough that it's 1 meter or 3 feet or 4 feet is enough?
Because frankly speaking, these are the all numbers only. So practically we have to understand. So first, close contact you have to avoid at any cost. Number one, I think three to 4 feet is good enough to avoid the contact, basically.
Okay.
Number one. And second, somebody is not well. You are not supposed to talk to him very closely, or you better to put the mask and tell the other person who is not well to put the mask also. Because if you're going to cough very vigorously or forcefully in terms of the sneezing or coughing, or in fact some people we have seen are laughing and talking so widely, so this all the larger droplets will go and they're going to cause the infection to the other person also. And in fact, if you're going to cough very vigorously or violently, then the cough droplets going to deposit in a particular space. And if you're not going to be there, you consider nobody was coughed or nobody was having any problem in this area, you're going to touch that area or table or any household object.
So how long
anywhere
can it stay,
working.
doctor? How long can it stay in that particular surface, or that hard surface which you're speaking about? How long can it stay?
Yeah, so that can stay for 5 to 10 minutes also. We have seen in the clinical practice, and all the data and all these things are there. Then take for a longer period of time. In fact, some of the cases, if the droplets are very big enough, like in the form of the liquid, probably sneeze or secretion from the nose or maybe from the mouth, that's going to stay for more than 5 minutes.
Absolutely.
So that is what the hidden asymptomatic things will come in the picture. So person is going to have a touch with that particular area which is already infected with the droplets or liquid or in the form of the dust or any kind of thing. So if you're going to touch the person with this contaminated liquid or anything, if you're going to touch in the face or any part of the body, chances are pretty higher.
Absolutely.
Although,
now, you are, an internal medicine expertise is there, and you have specialized in the same. So now, will it have an impact? If at all it's proven as an airborne disease, will it have an impact on the vaccines which are being developed, or is it completely fine? It is not going to have an actual effect on the vaccines that are being developed now?
Yeah, basically this what vaccine we have planning. India, the first indigenous coronavirus vaccine is coming in the near future. So basically it is a more of inactive kind of vaccine. It's not a live vaccine. So inactivated vaccine has been developed already in India. So we are waiting for we already isolated the SARS-CoV-2 strain in Pune.
Correct.
And then this vaccine is identified in 12 clinical trials, and still we are waiting for the means like probably final call and investigation to launch the vaccine for the public health, at least probably before 15 they are planning, and then they should cut down the further investigation before 7th of July. So that it's basically inactivated vaccine is not going to alter the probably kind of research what we are doing, and we are going to come with a vaccine. If it is a live vaccine or activated vaccine is there, it's definitely is going to it's going to be difficult. But since it is an inactivated vaccine, it's going to be helpful, and it's not going to altered by either if you say the source of a transmission of infection is a little different than the airborne disease.
Okay. Many thanks, Doctor, for joining us with all of those insights, especially with respect to whether or not we can consider this as an airborne disease or not. Probably the studies have proven so. They have shown that it does stay in the air. It does show that probably for 10 minutes it'll be there in the air, and social distancing probably will have to be there, need of the hour. All of you have been following up, but World Health Organization has put down several guidelines, advisories are there. Probably now with these studies coming in, with the experts going forward and requesting for the World Health Organization to consider and also hold meeting and understand what exactly is happening, whether or not it can be suspended in the air for a really long time. Well, that is something which we will have to wait and watch. World Health Organization probably, like even the internal medicines doctor has said, Dr. Pankaj Singhai has said that probably it's time that World Health Organization starts considering it, and they revise their guidelines accordingly, according to the studies which have come to the fore. We will continue to give all of the latest which is happening. We will hold discussions with all of you as well. But do remember, again, we reiterate what is being said by everyone. Wear your masks properly, not to your chin, but till your nose, and also maintain your personal hygiene, and also maintain social distancing so that you can avoid the virus, because now that the studies have shown that it's an airborne disease. That's all we have in this session of Facebook Live. Hope you liked it. Do join us in the next Facebook Live session. Thank you.